It worked. Hey,
How are you?
Happy.
Can you hear me okay?
I can. Can you hear me okay?
Absolutely, yes. Thank you for joining us.
Oh, I've been looking forward to this well, we scheduled this a while back, but definitely all day. How are you?
I'm doing well. We're excited to have you here, and I just want to kind of read your bio and kind of just give my audience a chance to kind of get to know you a little bit here. So,
sure.
Again, Dr. Kalli Hale is a passionate advocate for the connection between dental health and overall well-being. With expertise in obstructive sleep apnea, she collaborates with dentists nationwide to develop treatment protocols. Dr. Hale's work in pediatric expansion and sleep disorders has propelled her speaking career, focusing on improving children's health. As a clinical advocate for the Vivos Therapeutics and a faculty member of the Dental Success Network, she travels extensively to educate dentists on obstructive sleep apnea. In 2022, Dr. Hale and her husband, Kyle Hale, and their longtime friend and business partner, Dr. Matt Hicks, founded a new way of bringing airway to the masses, the Airway Dentists. In 2023, the first 2 locations opened in the suburbs of Houston, Texas. Dr. Hale also has a podcast, the Sleep Well Journey podcast, that not only lets the listeners get a peek behind the curtain, but we're also routinely sharing a digital newsletter that highlights changes in the industry, science, and treatment. So thank you for joining us. I'm not sure if you can still hear me, but I think the screen may have froze on your end here. We're going to wait to get Dr. Hale back here. I'm going to try and re-invite you. Hey, there we go.
I don't know what happened. I was just loving listening to you. That was a beautiful introduction to me. I appreciate it.
All good. Yeah, well, again, I just wanted to give kind of the community a sense as to who you are and your background, but I'll kind of give you the floor too. Just tell us about your journey to this type of dentistry and kind of how you ended up where you are.
Oh, I would love to. So I come from a family of dentists, actually. I'm one of 5 in my immediate family. My parents met in dental school. I'm married to a dentist who's my high school sweetheart, and my younger sister's a dentist. So this is all we do is live, eat, and breathe teeth. And we all kind of have our favorite niche in dentistry. And mine went from very holistic biologic dentistry, which I still love, to airway dentistry, which was my biggest passion. Honestly, I never thought I would find something as motivating to me as holistic and biologic dentistry until I started treating airway for both adults and kids. So it's been such an honor, such a huge journey for me, both personally and professionally. And I absolutely love what I do, and I believe in it wholeheartedly. So.
No, I love that. It's great to hear that you come from a family of dentists. I'm the first dentist in my family, but yeah, no, it's a wonderful profession here, and great to hear kind of your journey to where you've come to so far. And tell us, in terms of airway dentistry, you use some terms that I want to make sure that the folks at home kind of know what you're talking about when you reference holistic dentistry, biological dentistry. How does that maybe differ from what a conventional dentist or I guess the normal type dentist is in the community?
I mean, really, it's just like a heavy focus on our systemic health. I think in dental school, at least for me, we were focusing really just like right here, like the teeth.
Sure.
And I was trained very traditionally, went to a wonderful dental school in Texas, University of Texas. And I loved and appreciate my education there. When I got out, there was a lot of literature and a lot of evidence in support of things that I had never really thought about before. Like y'all's wonderful toothpaste, for example, not using a fluoride toothpaste. Like what would that be and why would I need that? Or why should I pay attention to that? And it took kind of learning the hard way, but a long road of education and paying attention to literally this mouth is the gateway to the rest of our body. So anything that we're putting in here, we need to make sure is healthy, clean, and doesn't have bad side effects, you know? So I focus on all of that. We have a cone beam in our practices to look for hidden infection in the jaws. And I also pay a lot of attention to why you're getting decay. You know, like we kind of preach this fluoride varnish twice a year, and that should be the sole thing keeping your teeth from getting cavities, which is just not the case. We have mouth breathing, obviously the diet, talk, and sugar, but mouth breathing causes rampant decay, and it's a huge sign of sleep disorder breathing as well. So when you just start connecting the puzzle pieces together, you can see how the body wants to work in harmony and in homeostasis. And when something gets off kilter, then we start having things degrade, like the strongest component in the body, like enamel.
You make a great point. And, I practice here in South Florida, and I have a big geriatric population. And a lot of my patients, they really struggle. I mean, look, everyone's on prescription drugs down here. And one of the side effects is xerostomia. A lot of the older folks, too, they're mouth breathing and they have chronic nasal obstruction. They're just at a high risk for recurrent decay around existing restorations. And I really talked to them about the importance of nasal breathing, the importance of nutrition, and really try and help them combat this disease. So you bring up a lot of good points that are important for wherever you practice.
Absolutely, for sure.
Yeah. So tell me about the importance of oral health and how that might affect sleep, or what signs or symptoms do you see, and the correlation between sleep dysregulation and oral health?
I mean, that's such a powerful thing, because I often think, well, what's coming first? Is it the poor sleep and then we're mouth breathing, or is it mouth breathing and that's hurting the teeth? It's this vicious cycle. So I would say for dentists that are checking patients every day, if you've got abfractions, you've got root decay, you've got obvious mouth breathing, dry mouth. I would know in the elderly community, dry mouth for sure is a big deal. And if you have that, then it's really important that we are assessing how you're breathing and sleeping at night. In that regard, if you have a patient with dry mouth, of course, check their systemic meds. Like, what is their health history? How old are they? How are things, reacting in the body? But if they're younger and they have that, and you've got decay too, we want to make sure that they're sleeping with their lips closed.
Those are all great steps here. And one of the things I talk to about patients in my practice is, look, decay is a preventable disease. A lot of it goes back to nutrition. Saliva has a lot of buffering properties against decay. So when you have dry mouth, whether it's through mouth breathing or xerostomia, you're already at an elevated risk for decay. So that's one of the topics we talk about a lot routinely here as well.
Yeah. And it's really no different in children or younger adults too. Like, I know you're dealing with the elderly population, but if we've got mouth breathing in kids, we're going to see the same sort of like degradation of enamel and decay, because the saliva pH has dropped, and we don't have that protective layer of non-acidic saliva over the teeth.
You make a great point. And speaking of children, what sign or symptoms do you see in youngsters, or what my parents should be on the lookout for?
Oh my gosh, there's so many. I could go on forever, but probably my top ones would be tooth grinding. And this goes for adults too. If you've got a patient who is grinding, they're in a night guard, for example, we need to be thinking about sleep disordered breathing and obstructive sleep apnea. Not a single patient is prescribed a night guard in my practices unless we have done a sleep study first, just to make sure we're getting to the root cause of that bruxism. We know that bruxism is linked to getting better air in. It is a reaction to the apneic event. So it's just an important thing to recognize. And honestly, it's no different in kids. So if the kids are grinding their teeth, I'm immediately considering a tooth pull appliance, oral appliance therapy for them while they're sleeping to help grow the arches and induce the nasal breathing, which they so desperately need. So tooth grinding is one big one. The other is snoring. And again, that goes for both populations, old and young. A child should never snore. One of my biggest regrets is telling a parent that their child's snoring was normal and they'd grow out of it. Because that's what I was told. That's what I was told in dental school. And I regret it terribly, because it's not. It is a huge warning symbol. And we wouldn't have snoring adults if we didn't have snoring kids. So to think that they're just going to outgrow it and it'll never be a problem again makes no sense to me. It's not in the literature.
Yeah, I love your passion on this topic too. It's funny, like when I was in dental school, I don't remember really hearing much about a lot of these topics. And I'm a 2009 graduate, and it's just, you got to continue to re-educate yourself and stay up with literature, because a lot of this just wasn't being spoken about.
It wasn't talked about. I mean, the extent that I got on obstructive sleep apnea in dental school was that if you were obese, you had it. I mean, it was really just like a neck circumference, like weight on the belt sort of thing. I just, it is, I think, the most important thing we should be learning in dental school is how to screen kids and adults. Whether you want to treat it or not, it's honestly irrelevant. But to screen it and catch it so that we can refer appropriately is vital. Like, it's unacceptable to not be screening. I mean, the ADA called us to start screening back in 2018 or 2017. But it's just a matter of how do we do that? If you've never been taught it and you are busy and you're in practice, how do you screen? How do you implement that in a way in the offices? So anyways, I could go on.
No, it's a great point. And speaking of referrals, do you have an orthodontist that you work with routinely, or do you do palatal expansion, or what's your philosophy on actual treatment modalities?
Yeah, I do most of it myself, but there are wonderful airway orthos across the United States. You're in Florida, right?
Yes.
Yeah, okay, so I'm in Texas, and it is definitely not as well known here, but when you live in this space, you find your people, and we have great referral sources from pulmonology, ENT, sleep medicine, ortho, like chiropractic, myofunctional therapy. It is just a massive network, and we kind of find each other because we need each other. I tell my patients all the time, it's not the Kalli show. I can fix you and I can get your jaws wider and I can get your occlusion better and I can make sure you're a nasal breather. but I might need some help from some really smart people along the way.
And to that effect, for parents, it can seem kind of daunting because we have dentists, orthodontists, myofunctional therapists. Like, where should a parent start on their journey if they feel like they suspect their child has some sleep issues?
Yeah, I mean, it can be such a hard thing to navigate, especially in various locations across the United States. So I'm a founder and a chief dental officer of a company called Tooth Pillow. So if your child is between ages of 3 and 12, we can virtually screen them. This is an unprecedented sort of company where their airway health has never been more accessible because of the Tooth Pillow company. I also have my private practices in the greater Houston area. We're known as the Airway Dentists. So people that are local can certainly come to see us here. But the Tooth Pillow website has an entire process. And you guys know, because we love your stuff, it's been in our boxes. But the Tooth Pillow website has blown up recently thanks to some awesome people. And you can submit your child a series of photos, a sleep questionnaire, and they will get paired with an incredible airway dentist in your state where you will receive a custom video of your child and what recommendations we make for their treatment.
Hey, what a great service for people in your community across the country. I'm curious, what's your philosophy on using implants, tabs, or MARPI therapy in terms of expanding the dental arch and how to help folks with some of these constricted conditions?
Absolutely. I mean, there are so many ways to help once you are a full-grown adult too, which I don't think people realize. So like in the late teens, 20s, all the way up, you have surgery. There's MMA surgery with powerful oral surgeons. One of them that's very well known, Dr. David Alfie, is actually here in Houston. So of course I work with him for my patients that need upper and lower surgery. Extensive orthodontics like MARPI, Dome, SARPI. There's all sorts of ones. I am a fan of all of it. I mentor a lot of dentists in the space. Whatever works best in your hands, I support. We've got to get the jaws wider. In my personal practice and all of my training, I do non-surgical therapy for all ages, from 3 to 100. Okay. Teeth and a pulse. That's all I need. I need teeth and a pulse, and I can help with removable appliance therapy. So, and then obviously with the kids, fixed appliances, upper and lower, I am heavy on making sure we're treating both jaws, not just the top, so that the relapse rate is greatly diminished. So yeah, there's lots of different ways, and I'm a fan of it. Especially the habit corrector appliances like the tooth pillows. We use a couple of different brands in our tooth pillow company remotely. Anything we can do to convert the patients to being a nasal breathing child and a nasal breathing adult is going to help them to age better. And we all need to age beautifully and better.
Absolutely. Amen to that.
Thank you.
Well, I don't treat children routinely in my practice here, but for a lot of my patients do have children, and a lot of times they'll ask me like, "Hey doc, what's your advice on this and that?" And I can talk to them about cardiology and nutrition, but what advice do you have for parents and I like to practice preventative medicine. It's great whether we have treatments, but if we can prevent conditions before they start, what advice do you have to parents to try and prevent some of these disorders from occurring in pediatric patients before they start? Maybe looking at oral hygiene tips or nutrition or...
Yes. The nutrition and hard food diet is one of the most powerful things. We live in a society where the Western diet and Western culture has destroyed our nutrition. It has destroyed our oral development. You've got to have your tongue and your lips working hard in those baby ages to chew and stimulate muscle and bone development. I'm a big fan of baby-led weaning. So if you have a 0 to 3 age, that is a wonderful book to recommend to parents to be able to do hard foods safely. We don't want anybody choking, obviously, and just really stimulate that oral development. Also, when it comes to like pacifiers, which obviously I'm not a fan of because of the distortions it can make in the mouth, but there are some brands that we do recommend at Tooth Pillow that help stimulate a pacifier action that is more like breast. Like we're very much wanting the mothers to breastfeed if they can for as long as possible, which helps with the oral development. So elongated breastfeeding, hard food diets, and then making sure that if they're using any sort of teether, that it is stimulating oral development at the same time. So we have brands that we approve of and like for babies to be chewing on and helping them with their oral development. There's tools like the Myo Munchie for really, really little babies that we like just to help stimulate tongue movement. We want the tongue up and breathing through your nose.
Yeah, no, that's really important and great advice for a lot of the people out there. And I try and reiterate and communicate that with my patients as well. In terms of holistic dentistry, how do you see products like RiseWell and other folks in the space fitting into a more holistic approach compared to some of the traditional big box brands that are out there? Do you have conversations about recommendations with patients? And
I mean, you guys are just changing the narrative, which is my jam. I'm trying to change the narrative in sleep disorder breathing, and y'all are changing the narrative.
Rock on.
Oral care products.
Love
like
it.
100%. We've used y'all in my private practices for a long time. Like, it is just incredible when the patients are coming to me saying, hey, so I heard about this RiseWell stuff. Do you like that? Because so many times they just want my opinion. Like, do you approve this product? Is this safe? And I'm like, oh my gosh, yes, I should. Like, I've got it in my kids' bathrooms right now. Like, it's great. It tastes wonderful. And so anyways, it's just powerful stuff. And it's such an important aspect of our growing kids' health, because there is more and more awareness now on the dangers of fluoride, especially in high quantity. And trying to brush your kids' teeth with a fluoride toothpaste, but you don't want them to swallow it. Like, come on, like there's an issue here. Like, why are we using something like that if it could have a really negative side effect? And in my personal opinion, they're getting those cavities because they're mouth breathing. So we're chasing something with the wrong tool. And I want to make sure we are remineralizing our teeth with the proper substance, like the hydroxyapatite. So I'm a huge fan. I'm super glad you guys are around. And I know that my patients appreciate it as well.
Well, thank you for the compliments. And it was kind of interesting going down this rabbit hole myself, because again, back in dental school, look, we're not against fluoride. We know it works, but you know what? Metal fillings work, but people want alternatives. They want better choices with potentially less health side effects. And so when my sister and brother-in-law were going down this journey of creating RiseWell when they were starting their family, I was thinking back to dental school, like, man, why didn't anyone ever talk about hydroxyapatite? Maybe had one mention of it in oral histology first year, but besides that, it's like, what? They were using this as a remineralizer in countries halfway around the world for decades, and we really haven't even heard about it. This is nuts. So, and that's
unfortunate, because I even think the knowledge of like airway center dentistry is more known in other countries, especially Japan, things like that, whereas we are always behind. It feels like it's so frustrating, especially to have our infrastructure of the United States of America, And I agree. One of the things I explain to patients, though, when they comment on that, or they're like, oh, I don't know, it's always worked for me. Like, is just medicine and dentistry are always changing. Like, if we don't understand this at this point, that we don't know everything, and 10 years from now, we're going to be maybe talking about something else. Like, we need to do the best that we can do right now for our patients, which is to make sure that what we're putting in their mouth, which is literally going to get absorbed into the rest of their body, is a clean, healthy product.
Amen to that. Do you find in your community that there is acceptance or resistance with your peers in terms of airway knowledge, or do you routinely find that you have to go overseas to get the latest cutting edge information, or people in the community on board with airway, being proactive with airway health?
Yeah, great question. So I don't feel like I have to go overseas to get the information. It's being heavily studied and documented right now in the United States. I'm a cowboy, though. I started this stuff before it was popular. Like, everybody now is asking for like nasal dilators and lip tape, and it's like the fad right now, which is great. I'm here for it. But I don't know that I have to go outside of the United States, although I love looking up research over there. Some countries are better than others in what they're allowed to do and kind of how they view some of this primary interceptive orthodontics, but we can definitely find it here. As far as like acceptance in the community, when it comes to the people, they're all about it. The patients just want help and they want to be healthier. We're not a healthy society in any way, shape, or form. So like whatever we're doing is not working. So any idea that we can do it better, we need to do. I would say there are certain specialties in dentistry which you're going to find a little bit more resistance to, but it doesn't stop me from saving the kids. It certainly doesn't stop me from doing what I love. But I think if you're a newer dentist watching this and getting into that, I would say find your people, find a really good organization to join and be involved in, to give you a little bit more confidence, a little more power in your space when talking to patients.
I love your enthusiasm for the topic here, and thank you for all the work that you do. I was curious, in researching you for this, I discovered you have your own podcast. Tell us about that. Tell us about that project and where viewers can find you and what they can expect from that program.
Oh man, some wild raw Kalli is what they can expect from that. Yeah. So my husband,
all right.
like I said before, my husband's a dentist, and I think it was a little over a year ago, and he just walked in the office one day and he was like, "You're starting a podcast," and I was like, "You're crazy!" I was like, "Who's gonna listen to that? Like, what do you mean?" I kid you not, a week later, he had one of the old rooms in the office totally outfitted with cameras and mics, and all of a sudden I was like, I am empowered. Let's go. I could hear it was awesome. So the name of the podcast is The Sleep Well Journey. It's got YouTube. It's on YouTube and all the main podcast platforms. I love the YouTube channel because I just think it's funny for people to see my face and his face as we're bantering back and forth. Season 1 is heavy on my philosophy for oral appliance therapy and care for kids and adults. It's really Kyle and I just talking back and forth about what I've been doing for so many years and how I have patients traveling out of state to see me, or why is what we're doing different. And then the second season, I interviewed a ton of really cool people. I interviewed a bunch of providers in this space, a world-renowned cardiologist, Dr. Peter Wynn. He was absolutely outstanding, and a bunch of really wonderful practitioners and allied health providers to bring a little bit more outside knowledge to right to you on your phone.
Now, what a great resource. I look forward to helping promote that for you.
I appreciate it. Thank you.
I'm curious, did you do a residency in Airway, or was it a journey of numerous CE events, or how did you kind of accumulate this knowledge to be able to help folks in this space?
Yeah, so I kind of did anything and everything I could get my hands on. So I did a really extensive postdoctorate program back in 2019. And then I did a mini residency in 2020. And then I started studying for every diplomat exam that you could take within the various dental sleep medicine categories. So I have my diplomat to the American Board of Dental Sleep Medicine and the American Sleep and Breathing Association. So I really don't do anything halfway. And I'm like, I lecture all over. So I'm like, if I'm going to be up on stage and I'm going to be showing cases and talking about this, I better know my stuff, because the first thing that ends up happening is really tough questions. And if I don't have the answers for them, then I'm not the person that you guys should be getting advice from. So.
No, hey, I love the credentials, and it's a great point, and I love that you're lecturing and just disseminating this information across the country.
Thanks, I appreciate it.
I'm curious. Tell me, in terms of moving forward, what gets you excited about future trends, novel treatments, different approaches, or how to continue to get this information out to the public?
I mean, for me, when I love that question, like what gets me excited? My husband and our partners, like you mentioned earlier, Dr. Matt Hicks and all of that, like we have such a global, broad view for what we truly think dentistry should be for everybody, but really developing children and adults that have sleep disordered breathing. So we have our chain of the Airway Dentists that I told you about. We would love for there to be one in every single city in America to support even the virtual tooth-filled stuff that we're building, right? So globally, it's as much as I love chairside dentistry and I still treat tons of patients a few days a week, globally, I want every dentist to have the proper mentorship and the proper education surrounding dental sleep medicine, because all too often, even in my own private mentor group, we have doctors that have tried this. They've taken every course and there's been kind of a failed launch. They don't know how to involve their teams. They don't know what exactly to say to the patient, or if they can really help the patient, and if you don't know what you can do, it's really hard to talk to somebody about it. Going through a sleep study with a patient is a whole lot different than telling them they need a denture or a root canal. It's very different. They're scared for their health, and now you got to tell them something that's kind of expensive, or they got to go get an oxygen mask on their face, So I would love to be just an absolute resource to those that are in the trenches with me, treating patients each and every day.
I think it's great. I could definitely use that resource here in South Florida. I know there are some sleep medicine providers out there, but it's just not something that a lot of dentists are comfortable with. We don't have the knowledge, the vocabulary for it. So getting that support from a national network would be wonderful.
Yeah, when I started the Sleep Well Journey podcast, it was probably about a year later that I launched the Sleep Well Journey mentorship program. So I've got an incredible elite group of docs that we meet a couple times a week just to talk about cases and talk about their oral appliance selections and what they should do. And every single one of them is starting more cases every day than they say they ever would have alone. So it's really rewarding for me. And I love doing that. I've always loved to teach. I can't see myself going back to dental school. I can tell you that for sure. But I love to teach. I used to teach piano lessons when I was a kid, and any amount of motivating that I can give somebody to go do the best and right thing they can do, I love it.
I don't believe it, Bert.
Thank you. I appreciate it.
It's kind of funny how some of these cycles in dentistry are cyclical. When you were talking about some of the etiology and root causes of things, a lot of things going back to nutrition, a lot of these conversations I kind of refer back to a good old Dr. Weston Price book, looking at from the 1930s. There was a dentist that kind of took time away from his work, traveled the world, which is kind of unheard of at that point in time, to study native populations and looking at how native populations had beautiful arch forms, low incidences of decay. They were probably nose breathers, Whereas when he went to the indigenous populations that were along the coast and were starting to trade with Westerners and consuming a Western diet, that's kind of when all hell broke loose, because the incidences of decay skyrocketed.
Yes.
You had a partial edentulosum, narrowing of the arches, probably leading to mouth breathing or vice versa.
Absolutely.
And it was kind of interesting that this knowledge was kind of around for 100 years, and
Absolutely.
we're just kind of coming back to it sometimes.
Absolutely. And that's so important to point out, because I think a lot of the confusion that even families have is, oh, well, is this mouthpiece for the kids new? Like, is this something people are trying out? And I'm like, actually, no. Like, it's not. Like, these appliances have been around for decades and decades and decades. But if you're not taught it in dental school, you're not going to go out and do it. I mean, if you're not taught how to screen, you're not going to go out and do it. Right? And so when you actually go back in the literature and you're looking at the history of orthodontics, we've got a book that's like, I don't know, a few hundred years old that we found on eBay that we were like, we have to have this. My husband and I are reading it. And it's just like unbelievable what they knew that got pulled out of the education system like 50 or 60 years ago. One big thing was myofunctional therapy. That was literally invented by the orthodontists.
That's wild.
It was pulled from their education 50, 60 years ago, and then it dropped. And now we have a whole bunch of problems again. So it's not new, and you just don't know about it. You know what I mean?
Yeah. Wow, that's really fascinating. But hey, I want to be respectful of your time. I'm really thankful for you to hold space with us today. But tell us, how can our viewers help support you, and where can they find you, and what projects are you looking forward to?
Well, I would love for you guys to follow the Airway Center Dentist page, which is the account I'm on right now. That is where I am constantly posting updated information about my own cases and things that we're working on and projects. And if you are not in an area near us, we are in all 50 states with our Tooth Pillow virtual platform, which is toothpillow.com. Again, that's just ages 3 to 12, but we are happy to help you find somebody near you at the ages of 13 and greater for whatever your needs may be. And I just appreciate your time. Absolutely having me just today is such an honor to be with you guys, and I really appreciate it.
Our pleasure. We enjoy promoting folks like yourself who have so much knowledge to contribute to the space. And I want to switch over to our live Q&A session now. So we have a lot of viewers out there that some topics are on their minds. So we'll go ahead and dive in. First viewer is curious, how many years do kids need to wear a tooth pillow for?
So it just depends on what age it is that they start. I mean, by the time a kid is 12, their head and neck development is 90 to 94% done. So your options change pretty drastically by the time their age is 10 to 12. Now, in my private practices, we fee everything out at 24 months of treatment. They may need it longer, and it's no different with our virtual stuff. But we have it in there for 24 months, but they may need it longer.
All right. Well, thank you. Next question is, are there benefits to fluoride, and what are some of the risks?
So the risks are that it's a neurotoxin at high doses. So, I mean, you can take that for what it's worth. There is like a 95-page document on the International Academy of Oral Medicine and Toxicology's website that talks about all the papers that they've had on fluoride. For some people that still choose that, that's fine, but I still take the time to educate them on what I really think the decay is being caused by, which is a poor food diet, high carbs, high sugar, and mouth breathing.
That's a great point. It's funny. No one gets decay because they're fluoride deficient. It's not naturally occurring in the body.
Exactly. Very good point. I love that. I'm going to steal that. That's really good.
Next question. What are the best ways to find an airway ortho referral in your area? So we are definitely able to help you virtually through our platform. I would say most of the time I tell people to look up airwayhealthsolutions.org. They can find, if you're outside of that age 12 and greater, or you just simply want an in-person exam, the people that have been trained there are stellar and top-notch. There's also a company known as vivos.com. I don't think their provider search locator is working anymore, so I would start with airwayhealthsolutions.org. All right. Let's see. Next question is, studies have shown glycerin in toothpaste do not allow absorption of minerals. Can you tell us more about this concern? So I'll put my 2 cents in on this one as well. So essentially, we want to follow all of the available evidence that's out there, and we have not seen evidence to suggest that glycerin impairs the absorption of the hydroxyapatite into the tooth crystal structure. A lot of the companies use it. It helps to create a good consistency and pleasant experience when you're brushing. And we want to try and remove everything we can from our products here, but we also want to have a good experience. Sometimes when there's nothing to really hold your material together, it's just not a great experience. Everything we're using is certified clean by the Environmental Working Group. So we just haven't seen that it impairs with absorption. Do you have any thoughts on that, or
I was going to say, you put it beautifully. It's really hard to navigate, I would say, for the public to figure out all the things that are online about products, right? And I think if you've got somebody that you really trust and follow, such as yourself, then I think you pick the person that you align with the best and go with that. And I know you guys are following the research, and I think that's really important. So you said it best.
Hey, thank you. And last question, what would you look for in finding a dentist who will do all this screening and who would have this knowledge?
An airway dentist, an airway dentist. So most of the ones that do it to the extent that I do, which I don't know, there's a few like across the United States, but they're going to talk about it on their website. They are. And again, I'm happy to help find you somebody, even if you guys are just DMing me of like, do you know anybody in Florida? Do you know anybody? I know them all over. I single-handedly help pick all of the providers that we have for Tooth Pull Virtual, which is like over 63 doctors at this point. So I will help you find somebody. Again, there's lots of resources.
Well, I want someone with your enthusiasm. Everybody go check out Dr.
Fly to Texas. No, I'm kidding.
Everybody go check out Dr. Kalli Hale's work at the Airway Dentists, and check us out at RiseWell.com. Thank you, everybody.
So much.